Hey, my name is Rowan Hester, and this is my research project about Big Pharma and its effect on athlete health and nutrition. Big Pharma refers to large pharmaceutical companies that manufacture and sell prescription medications. These are businesses focused on profit, and they play a major role in how we manage health, pain, and injury in sports. While they have made many advancements in treatment and recovery, recent research shows that their influence can lead to overuse of prescriptions and medical decisions that prioritize profit over long-term health. While Big Pharma has helped athletes recover and perform through advanced medications, research shows that it also leads to over-reliance on prescriptions and treatment decisions driven by profit rather than long-term health and recovery. Positive contributions of Big Pharma. Pharmaceuticals have made it possible for athletes to manage chronic conditions like asthma, diabetes, and infections. For example, medications like antibiotics, asthma inhalers, or insulin allow all people, but also athletes with chronic conditions, to stay active. Many medications are widely used to support recovery after injury or surgery and allow athletes to return to competition faster. These are important contributions that can't be ignored. When used appropriately, medications improve quality of life and extend athletic careers. Overprescription and risk in young athletes. However, overprescription is a growing concern. According to a 2024 study by Benjamin and others, 20% of U.S. children have received an opioid prescription by the age of 18. Among youth and athletes with injuries, 63.9% were prescribed pain medication, and 22.5% of those prescriptions were opioids. The same, the same study states that overuse of opioids in sports is tied to a culture of playing through pain, even when rest or other strategies might be better for long-term health. The authors recommended that pain medication be used only when truly necessary and is always under supervision. Overuse of common painkillers, NSAIDs. Even non-opioid medications carry risks. A systematic review by Pham and Spaniel in 2024 examined the use of NSAIDs like ibuprofen and acetaminophen in athletes. Their research found that while NSAIDs help reduce pain and inflammation in the short term, they do not enhance muscle repair or improve long-term recovery. In fact, frequent use can cause gastrointestinal damage, bleeding, and may delay healing. This shows medications often used casually by athletes are not always the safest or most effective solutions. Profit motives versus health. An article by Traer and colleagues in Brett and Breathe explains that pharmaceutical companies influence healthcare at nearly every level, from medical education to prescription practices. They note that some doctors receive financial incentives or are influenced by pharmaceutical marketing, which can affect how treatments are chosen. When influence, when profit influences care, there's a risk that athletes will be encouraged to use medications instead of exploring longer-term strategies like rest, physical therapy, or nutrition. Nutrition as a better strategy. Research clearly shows that nutrition plays a critical role in both preventing injuries and improving recovery. In a 2022 article by Kevin Tipton published in Nutrients, the author explains that specific nutrients can actively support the healing process for muscle, tendon, joint, and even bone injuries, which are all common in sports. The article highlights key strategies. Protein is essential for muscle repair and maintaining lean body mass during recovery. Omega-3 fatty acids, which are found in foods like salmon and walnuts, help reduce inflammation and support tissue regeneration. Vitamin D and calcium support bone health and healing, and antioxidants like vitamin C and polyphenols help reduce oxidative stress that builds up after intense physical activity. Tipton also points out that despite strong evidence, these nutritional approaches are rarely included in sports injury treatment plans. He writes that nutritional interventions are often overlooked, even though they are significantly improve recovery outcomes. This research supports the idea that medication shouldn't be the default option for every athlete. Nutrition is not only safer, but it also works. Including dietary strategies and injury recovery protocols could reduce reliance on prescription drugs and improve long-term health. Conclusion. To conclude, the research clearly shows that while medications have real benefits, over-reliance on them, especially when influenced by profit, can lead to poor outcomes for athletes. Painkillers and anti-inflammatory drugs may be useful tools, but they should not replace long-term strategies like nutrition, rest, and gradual recovery. Supporting athletes' health means that making decisions that are based on evidence is more important, and it's more important to do that rather than do what's easy and profitable. Here's my works cited. Thank you.